welcome to the show. As we speak to you tonight, Fiji is currently in a race against time to become COVID contained for the second time as cases continuously pop up consecutive days in a row. With us tonight, we have Dr. Rachel Davey, the head of family health from the Ministry of Health, to discuss COVID, its vaccines, and also all other COVID-safe measures that the country has to adopt in order to get to that stage. Before we begin, we'd just like to preface that before we began this particular show, we have been keeping in line with all of the COVID-safe measures, which is why we are able to do our show today without wearing the masks. Without further ado, Dr. Rachel, welcome to the show, and let's just take a look at what we've seen in the past week in the country. Talk to us about Fiji's COVID status and what it's looking like so far.
So basically the week started off, we know with the few press conference that our PS has done with Dr. Alicia, and to date we have seen 19 cases, and of which 14 were from border quarantine facilities, and 5 have been in the outside that. So that's where we stand as of now.
Looking at how we've progressed in the past year from where we were last year, pretty much running blind in trying to keep Fiji COVID contained and trying to manage the spread of the disease in the community. Yeah. And at this point in time where we are with numbers and cases still coming up, do you think that the ministry has been doing a pretty good job so far, and do you think that we will be able to battle what may be the peak of a second wave?
Good question. Yes. So this time around, we've been definitely working hard at it, and we've made some, especially with the lockdowns in the Western Division and now here, and certain areas in Suva within Cunningham area. So the team have been working around the clock in terms of containment, contact tracing. And I must say, it's like Dr. Fong's been reiterating that it's a pleasure to having it's nice to see that Fijians are coming forth and letting us know, especially when they were related to the cases in the Western Division and the movements, the primary contacts and the secondary contacts. So that's helped the ministry significantly, and that is what's helping us as we go ahead as well. So that in itself is significant support, and as we progress, we're definitely following very closely in the containment plans that the ministry constantly talks about every day to make sure we're keeping this virus where it should be, and making sure no new cases spring up.
Of course, with the measures that were put in place to keep Fiji COVID safe for almost a year, it's made things easier in terms of contact tracing, especially with the COVID helpline and with the app. Can you talk to us about that?
Yes, definitely. So that's where it's become so essential that we don't become complacent, firstly, in our containment measures. And while there may have been some complacency, but gradually we definitely need to know that, when we talked about vaccines coming in, we knew that vaccines weren't just the answer. We needed to constantly talk about every other aspects of COVID containment as well. So that's absolutely essential. And the app in itself is an important tool, because when you have that app on, the Fiji Care app on, and the Bluetooth is on, of course, you're able to know who was in your area within that period when that came about. For example, it makes it easier for the contact tracing teams to locate you as well. So that helps the country significantly with the contact tracing protocols and with the processes, helps in identifying individuals and obviously telling individuals on like home isolation and all. So,
of course, working with other stakeholders like, say, for example, the police and the military in terms of policing cordoned off areas like the containment areas and also areas that may be high risk.
Yes.
How has that been so far?
Oh, that's been amazing. I mean, with the Fiji's COVID response unit itself is exemplary. Not just in Fiji but to the Pacific and to the world, because we've literally brought into one room the whole government, and not just government, civil societies, NGOs, and made this happen. And the support of defense in itself has been amazing. So they literally, I mean, we know health is doing a bit, but with the support of the rest, it's making it a lot stronger team that we can imagine it to be. So that literally has strengthened our whole HR, human resources, and other aspects that we've needed. So that has been a great, I would say, a great learning experience for the country. So we can say we did it together.
Stay with us. We'll be back with more after this break. Dr. Rachel, we were talking about vaccinations not being the only way to keep Fiji COVID contained. And of course, that's true for all around the world. However, getting vaccinated is something that is essential in taking the first step towards getting to that particular goal. Now, there have been concerns raised by some who have been able to get their first dose of the vaccine, some who have not gotten their vaccine yet, and those that are not willing to get a vaccine. If you could talk to us generally an overview of why it is important to take the first step in getting the vaccine.
Yeah, thank you. That's an important question for us all, actually. And with this virus, when now we know that there is a vaccine available, not just a few vaccines available, and to top it off, it's available in Fiji. It's that first step of getting jabbed, getting vaccinated is essential. Because what does it do? What do vaccines do? It basically develops that antibodies against the virus in our body and helps protect us at the end of the day. And there's a lot that's gone behind it, a lot of science that's gone, definitely a lot of science that has gone behind it. And that in itself is essential for people to know that it's not something that has just come out of the blue and it's given to us. So vaccination is the first step, but like I said, it's not the only step. And that protection for us Fijians is essential because vaccines do a lot of benefit, and there has already been studies which have shown that there is almost 100% reduction in hospitalization of individuals with both the jabs, even with the first being but a portion of it. But yes, vaccination is essential.
To clear misconceptions, when you say that the vaccine helps your body develop antibodies to help fight off if you do get COVID, if you contract it, does that mean that the vaccine does happen to have traces of COVID, or is that just some false news that people are still perpetuating?
No, the vaccines are not does not have that. It has something that will replicate. It's an adenovirus that replicates within our body, but it's not the COVID virus itself. It's a similar lip replica. So that is what, when we're injected with it, it creates our immune response. And that immune response is basically developing antibodies against the virus in itself.
Could you tell us why there are 2 doses that are necessary and why the spacing between the 2 doses?
Yes, absolutely, yeah. So that with the vaccines, the one we've got in the country is AstraZeneca. Now, AstraZeneca has 2 doses, just like Pfizer as well. Only one vaccine has only 1 jab, and that's Johnson & Johnson to date for COVID-19 vaccine. And now the 2 doses are important because, firstly, when you get the first jab, it brings your immunity to a certain level. That's around 69% with the AstraZeneca. Now, with the second jab, it boosts it even more. And now that's important as well because they are equally important because once you get that first jab and you've got an immune response going, it's the second jab is given like as a booster to strengthen your immune system a lot more.
So it's not a half and half. It's more you get protection from the first jab, but for you to be fully prepared and fully ready to fight off a COVID infection, you must receive both.
Yes, so that you have a better protection than just by receiving the first. So with the hospitalization reduction we've seen abroad in Europe and UK, etc., we've seen that it's the second jab that has reduced that amount of reduction. So because obviously it boosts your system. Now, when we talk about what after this, like I've got the 2 jabs. Now, what after this? The question they say there is still unclarity as to when do people need the jab after these 2 jabs. It could be a year, it could be 2, it could be 5, depending. And for that answer, basically studies are still going on to answer definitely on that one. But having said that, it's similar to, for example, when people receive their tetanus vaccine. If I've got a tetanus vaccine today, 5 years later I'll have to have another one because I need to boost my immune system again.
And so there's no vaccine out there in the world for anything that gives you lifelong protection from any sort of disease or bacteria or virus.
Yeah, you will definitely need to get a booster. For example, even look at the flu vaccines. The flu vaccines, every individual, like especially in developed countries, Australia, New Zealand, etc., they get a jab every year. Even Fiji, we have healthcare workers taking the jab every year, just before flu season. So that's essential, and thus those 2 jabs become important.
So we've had the first batch rolled out. The second batch, of course, is rolled out just in the past few days. Can we expect more doses to come in, and of course for it to get to a point where if we cannot achieve herd immunity, then what would happen?
Yeah, so yes, we've rolled out the first 2 batches of vaccines that came. The first, the 6,000 being from the COVAX, basically that has supported the country with the 20% free vaccines for Fiji, and then the 100,000 doses from by the Indian government. And soon, and on Monday this week, we got the next 24,000 doses from COVAX as well. So with all that, we're rolling out as we're progressing, and to date we can say we've vaccinated about 10% of Fiji's population, target population that we're wanting to vaccinate. So we've done that, we've achieved that, and there's a lot. Like you said, we need to reach herd immunity. And we're targeting our Fijian herd immunity as at least 95% of our target population, which is 18 years and above, to be vaccinated. So that's important. And what basically that does is it gives that group protection, and it also protects the younger population as well, the less than 18. Because we know the vaccines that we're talking about right now is mainly for 18, it's only for 18 years and above. And that herd immunity gives that protection right now to everyone. And ultimately, when we get to that.
So far, the public's response to getting a vaccine has been pretty good, considering that the first rollout of the vaccine, the first batch, finished off a full 2 days before the intended last day of vaccinations. And of course, we continue with the vaccinations right now. You've mentioned we've got about 10% of the population vaccinated. At this rate, how long do you think it would take, hypothetically, if we were to continue to receive vaccines from the COVAX facility at the rate that we're getting? How far along do you see us being in the future before we get to that stage?
In terms of achieving the whole herd immunity, if we get the vaccines in on time, Ministry of Health with the rest of the team that's working on the ground could go out and do a lot of these jabbing, the vaccinations right across the country. And we could get this done within the next few months, but obviously it depends on the supply and demand aspect right now. We know that COVAX is supplying us 20% of the target population of Fiji we're talking about, but there is that 80% that we need vaccines for. So we're working on that supply, and like our PS, Dr. Fong did mention that there are vaccines coming in. We know they're coming in, and they gradually will come in. So as they come in, the faster they come in, obviously the faster we roll things out. So.
Thanks for that, Dr. Rachel, and we will be back with more to discuss vaccines and also proper mask use in the next segment. Stay with us. Dr. Rachel, we're talking about vaccines, and it got to a very interesting point, and we'd like to discuss this even further. So far, we're doing well in terms of the number of people that have showed an interest in getting vaccines, and of course those that are registering to get their vaccines if they haven't already gotten it. If we were to look at what the vaccine does to those that have protection and what the vaccine won't do in terms of those that still have protection from COVID, because it doesn't give you immunity from contracting COVID, yes?
That's right. So that's absolutely right. So with the vaccination in itself, it protects us from getting sick or being hospitalized. That's one of the important things the vaccines does to us. But it doesn't mean that we cannot contract the disease, the virus in itself. And you may be asymptomatic when you get the virus, but you can become a carrier and a spreader as well. So that's why it's essential that not just I get vaccinated, but I also get the rest of the population vaccinated to protect them from getting sick and being hospitalized as well.
Just to put a pin in that, to clarify, what is the difference between someone being a carrier and someone that is a patient? If for those that are not familiar with the scientific terms, what does being a carrier mean?
Basically, you can carry that virus around you and you can spread it. For example, if you're not doing the usual practices of masks and etc., you could, and even with social distancing, etc., you could be spreading it. So that's where you can carry the virus and spread it.
Would you be potentially asymptomatic if you were a carrier?
You can definitely be asymptomatic. We have had previous cases in Fiji which where they were asymptomatic and it did go out to their contacts, etc. I mean, we've seen that in Fiji in itself, and right across the world actually. So, but that's one of the things that the vaccine. That's why we say. I mean, again, I'd emphasize that vaccination is just not the only answer. So, if I get jabbed, doesn't mean I'm open free. I should be doing anything and everything without the appropriate COVID behavior in place. But we definitely need to put things together into perspective and do both practices. I got jabbed, fine, but I need to protect myself from contracting the virus and also spreading it, because we've got to be mindful. 10% of the population is a small portion right now. There's a good number that's not protected, and right now, even with the 10%, it's only halfway through.
If I, say for example, get my first dose, I've already received mine, and I cannot tell you with just how much enthusiasm I'm looking forward to my second dose. But if I go out in public knowing that I've gotten my first dose of the vaccine, I'm awaiting the second dose, does that mean that I can bypass COVID-safe measures by not wearing a proper face mask, by not practicing social distancing, and not, washing my hands and using sanitizers?
No, you can't bypass that now. Because remember, firstly, obviously, like we said, you can contract it, and then you can become a spreader as well. So that's why we've been just reiterating, do both measures at all times.
And just to clarify a few things, the first local case that we had, the soldier who contracted who contracted COVID, rather, he had received his first dose already, but that did not make him immune to contracting COVID. He was asymptomatic, correct?
Yes.
And for someone that may be wondering, okay, why can I not still move around freely even if I wear a mask and I wash my hands and I practice social distancing and I've gotten my first dose? Why must I still then follow ministry guidelines in terms of being inside the house, not traveling unnecessarily?
Yeah, so goes back to that same answer, I guess, is in saying that you would have gotten your jab, but you still can contract that virus from somewhere, because it can be on the surface, airborne, whichever way it is. So it basically, you can contract it and you can definitely spread it.
If we could just quickly touch on those that call themselves the anti-vaxxer community.
Yes.
What is the danger that people pose, those who happen to forward either misinformation, malinformation, or disinformation, as Dr. Fong had said earlier on this week, regarding vaccines?
Yeah. So that anti-vaxxer mis or malinformation, that's important to notice, like, why is that being raised? What are the questions raised around it? And if there is anything specifics that we can answer, obviously there's a lot of there's answer to everything, that why we've got these vaccines, why we're administering these vaccines, and why we need our Fijians to be protected in the country. So this is one of the things we're really trying to do, is create that, remove that misinformation, get the right information across. Because one of the last thing we would ever want to do is bring in a vaccine that is harmful for any Fijian. That's the last thing we would want to do. And we need to protect our people. That's why we've brought in a vaccine that is in the emergency use listing by WHO. So those essential measures we've taken, we've done it through our regulatory authorities. We've seen necessary papers, documents. Even before the vaccines are used in the country, every batch of them, we definitely re-look at papers, we re-look at everything before we administer any vaccine in the country. Yeah.
And this is, of course, to dispel rumors that may be persistent out there saying that the vaccines that are being administered are not proper vaccines, as they say, considering that there was an article that was shared by BBC earlier on this week saying that Mexico had been receiving fake vaccines, those that were manufactured and were not approved by WHO and by COVAX.
Right.
Can you talk to us about the dangers of that and the vaccines that we're receiving in the country right now? Of course, these are verified original vaccines, as we would say.
Yeah, absolutely. I mean, that's where the danger lies. But this is where the Ministry of Health is very stringent in this process. We like I said, we don't compromise at all in terms of paperworks, in terms of getting things right from the manufacturer, in terms of their papers, in terms of the batch of production they've got. So that for us in itself is essential. And without that, we don't go forward. Even if I have to wait for a bit, get those paperworks in place, and then we move forward, we do that. But without that, we don't move forward, because at the end of the day, we need to know that these vaccines are efficacious, they work, and they are the right product. And we've got a pharmaceuticals team right behind us on this that do this stringent process. That's where the regulatory authority comes in place.
If we could now move on to masks, Dr. Fong had mentioned that from now onwards it is absolutely essential for anyone leaving the safety and comfort of their home. The moment they step out, they must wear a mask. Why has that become so mandatory?
It's mandatory because we know that it can be spread through the air, and that's essential. And within this period, we do need to contain it, and with the mask, it gives us that additional protection, of course, that we need.
So if we were to look at masks, there are quite a number of masks that are being homemade, those that may not have access to proper surgical masks that are available, because of course there is always an uncertainty of whether or not there will be stocks that are available or whether or not they'll be able to afford them. For the homemade masks and for masks that are not produced by any particular pharmaceutical or medical company, can you talk to us about the possible dangers of not having proper masks and what is a proper mask?
Right. Thank you. That's a good question, and this is one of the things our comms team and the whole ministry has been working around to make sure that everybody gets the right information. And while I speak to it, I must also say that we've got a good information that's on our social media pages, exactly elaborating what to do, how do you make homemade masks, and basically put it, you need at least 2 to 3 ply cloth. And for example, if it's like 2 handkerchiefs put together, that's what would work in terms of prevention. And if not, if you could do 3, even better. And but very simple guidelines, because we one of the things people ask is like, okay, it could cost individuals dollars to buy this, and some of them, and if they have to do it every day for the whole week till or the whole month and going forward, that'll be quite expensive. But you can do homemade masks. We've got information of this out there, and like I said, a single cloth is not good enough when if fluid goes through, not good enough. And if some of the masks are seen to have a vent in front, and that's very dangerous, and that's not good for us to use, because obviously that's allowing air to come in and out, and if the air is coming in and out, the virus could go in as well. So that's important to note. But and I must encourage, I have seen some social media pages sharing a list of masks and what percentage of protection it gives and all. So please go back to the Ministry of Health page and the Fijian government pages to see what the right procedures are of this, because it's essential to use the right one. And definitely you can make them at home. We've given them in details, at least 2 to 3 ply, and then obviously just fit something perfectly, covering your nose and your chin.
Stay with us. We'll be back with more after this break. Welcome back. Dr. Rachel, this is our fourth segment. We were talking about masks previously, and you left off on a comment about masks that have vents in them. Now, for those that have already gone out and bought them, it does not mean that those are completely useless. You can, of course, put another material inside to sort of use that. I've seen people buy the disposable masks and put that on first, and then putting on the sponge masks and also the vent masks, sort of double masking. Is that helpful?
Double masking, well, we don't encourage double masking, but it's important to note that you use at least the right mask. And there's quite a number of masks out there, and definitely with the vent one, we're not encouraging it all, because for obvious reasons. But if you can, like I said, it's very easily done at home. So if
for
that can
those
be
that
done.
may not have access to social media, for our viewers that do not have social media accounts, just to clarify, when you say 3 layers, that does not mean that it must become a hindrance to your breathing, yes?
Yeah, it should be between 2 to 3 layers, and it should definitely give you very good breathing space, and you can and you need it mainly when you're going out of your home, and that's important. And making sure that well, elastic, whichever way you're using it, tying it up or elastic, but making sure that you're covering your nose. That's very important, that it goes on top.
Dr. Fong actually made a very interesting quip during one of his press conferences, saying that if you are wearing it below your nose, then it is a mouth guard. And for those that wear it either on the forehead, it becomes a headband. For someone that wears it on the nose, it's almost like a wearable hanky. Why is it so important to cover both the nose and the mouth? For those that may say, it's uncomfortable, I don't like it, it hurts, I feel awkward. Why must you cover the nose and the mouth at all times?
It's important because, for example, with the coronavirus in itself, we know that when we do testings, we swab through the nasal swabs, through the nose. So basically it harbors itself there. So if we're wanting to protect others and protect ourselves from harboring in these areas, we need to cover both. So that's essential. And these are orifice openings which get exposed to the virus. So that's important to note.
Looking at what's happening on the ground with health officials, of course, stretched to the limit whenever we have to battle community transmissions. As such, of course, containment areas are still being managed by health officials along with other stakeholders. If we were to look at the cooperation of ordinary Fijians that have come in to help out, of course, resources are quite limited from the ministry's side. Dr. Fong mentioned a few companies. Are we still encouraging individuals and or companies that may want to step forth and help out in either containment processes or anything else?
So yes, he did mention that just I think yesterday or the other day. So that's still going on. That's definitely encouraged. And they can always get in touch, like he mentioned, through 158. And also, if need be, they can always call our subdivisional medical officers or divisional medical officers, these health facilities. And whichever way they're willing to help, can help, be a volunteer, be a part of the whole process, the containment and all, is obviously sincerely appreciated. Because there's a lot going around.
If we could digress just a little bit and just take a look at the mental health and safety for those that may be struggling to get through this particular period. Quite a lot of people had pretty traumatic experiences last year, being away from family and friends in times of need. Say, for example, if there were funerals and there's only limitations for 20 people to be present. There's other cultural factors that come into play where there may be gatherings that they're not able to attend. Is there any way that we can sort of not necessarily circumvent this, but manage these protocols in a way where it's both sensitive to those that may be going through these hard times and yet also be COVID safe?
Good question. Basically, yes, it's not easy times, but in such situations there is no harm in calling somebody up in the ministry and asking them, I've got this situation, can I be assisted in any way? So definitely the team, especially our PS himself, is looking into all these situations. But where possible, we're trying to maximize to ensure all protocols are practiced for obvious reasons, because one spreader can become a super spreader like we've seen. So that's one of the things we're really trying to encourage is let's try to oblige to protocols in place, but where need be, we can always, individuals can approach the ministry and probably get an answer for things.
If we were to ask what were some of the barriers in terms of contact tracing and also containment procedures, would you be able to discuss them with us?
Barriers specifically, I believe the team on the ground would know a lot, but I think like PS had mentioned, Dr. Fong had mentioned earlier, it's like just people coming forth, and that has happened and that continues to happen. So that's been helpful for the team on the ground. And now when people are on the ground going out for their fever clinic checks, etc., the mobile clinics, it's happening right now. So that's essential that people cooperate. Yeah, just that will definitely overcome all barriers.
If we were to look at someone saying, okay, I do have a bit of a headache, I do feel slightly unwell, does that warrant a trip directly to the fever clinic, or must they get in touch with the Ministry of Health or helpline on 158 first?
They can call 158, or if there's about 40 fever clinics out there, they can definitely visit those clinics as well. If you're in that containment area, you can definitely call 158, and likely that our team will come and visit you. We know initially in the first day on Monday, there's a lot of individuals, workers who went to the west and came back this side, literally went into self-isolation at their homes, and if there were signs and symptoms that sprung up, they called us and we had teams go and visit them. But yes, definitely keep an alert out and don't be scared to come forth, because that's an opportunity for us to contain the virus in itself. Otherwise it just becomes another cluster of cases and etc. But we don't want to go that way. We would like to really contain the virus as it is right now.
We'll be back with more right after this break. Dr. Rachel, this is our final segment. Now let's look at the vaccine rollout. We've had the first batch already given out to the public. It finished off before its intended date. And of course the second batch was rolled out last week as well. When is the next shipment coming in, and what is the vaccination schedule looking like? Would you be able to tell us some details on that?
Yeah, I guess briefly, we're still a bit slight plannings going on as well. So yes, like I mentioned earlier, we've got about 24,000 vaccines that arrived on Monday, and now in the coming week we intend to roll them out. We started a bit today, on Saturday, yesterday, yeah. So we'll be rolling this out more specifically within Suva area. We've got a few frontliners that still have yet to be vaccinated. So within Suva and Nendilotoko corridors, we're focusing these vaccines, basically the west, mainly Nendilotoko being because of our ports of entry, being a high-risk space. So, and we've got our frontliners and some of their families who obviously fall into the risk as well category, so we're wanting to vaccinate a lot of them. While we've done majority of the frontliners in our first and second batch, we're mindful there's still some left, so we're wanting to cover all that. And when we roll this out in this coming week, we'll definitely let everybody know more information, when, where, timings, etc.
I noticed that you said that there's still some frontline workers that are yet to receive their first dose of the COVID vaccine. But does this mean that these are frontline workers that are outside of the management isolation quarantine facilities?
Yes, good point you put up. They are outside of the quarantine facilities, but the quarantine facilities, all quarantine facilities, isolation units, airports, etc. were done, and some seaports were done in the first 6,000 that we brought into the country. That uptake was pretty good, and now we still have a few that here in Suva, the ports, etc., and other frontliners that were yet to be jabbed. So we're doing them this time around as well.
So you mentioned that, of course, with the number of doses that are coming in, you will be rolling that out. But I'd just like to reference something that happened a few weeks ago, rather a couple of months ago in New Zealand, in Christchurch, where when the vaccine was rolled out there, some of the healthcare professionals were missed out, and they weren't very happy about that because it was rolled out to members of the public and it was basically first come, first serve. To avoid something like that happening, are there any plans in place for those that are healthcare and frontline workers?
Yes, absolutely essential. That's why we're going very targeted. We're doing targeted approach where we're ensuring that they all get jabbed, get vaccinated first as well. And once we're done with majority of them, then we go on to the others. And we're giving ourselves this coming week to do the 24,000 doses. Yeah.
And registration for vaccination still continues. Is that something that is still being encouraged for members of the public who haven't gotten their first dose?
Yeah, absolutely. We're still encouraging the general public to register, because one of the things that happens really when you register online is it literally smoothens the process for us. When you follow the registered line, you're out of there in a matter of within half an hour to an hour or a bit more, depending on the crowd. Obviously, we'll be having good crowd control in this one, but that's a more faster moving lane than those individuals waiting to be registered. So if at home, if individuals do have their birth registration number or their citizenship number or permit numbers, etc., they could register at home and just turn up with their reference number and just go through the system and get jabbed. But if they don't, definitely the vaccination sites that will be open, we will be doing registration on site as well. Individuals just need their valid ID when they're turning up to these sites. That's all they need. We can do the rest of the search for them. But for permit holders, we'd appreciate if they could bring in their permit numbers as well for this.
To clear any doubts about getting to the point where everyone gets their vaccines on time in a timely manner, this does not mean that only the first dose will be covered for the entire population. This is also to ensure that those that receive the first dose will, of course, be getting their second dose for sure. There's no way that COVAX or any other facilities that are working with the Ministry of Health is going to fall behind or not follow through with providing the second dose. Yes?
Good question. We've actually kept aside the second dose for individuals who've received their first jab here in Fiji. So that's safely kept aside. And when ready, we will definitely release them for vaccination. And then individuals get jabbed. That's one of the things we've had to do because of the supply issue globally. We couldn't rest assured that, okay, are we going to get our second dose for these number on time or not, because we know at some point there was delays,
and there's no risk of it getting near expiry date or any of that sort of stuff happening.
Nothing of that sort. We've worked ourselves back from expiry dates. That's very essential for us. That's why when we rolled out our 50,000, we needed to make sure that for every individual to get maximum immunity, that is after 12 weeks of at least 10 to 12 weeks of the first jab, we finished the vaccines, the first dose, at a certain time.
Just to clarify, there were stories going down the grapevine saying that the ministry is rushing forward with getting everyone vaccinated because the vaccines that they have are so-called near expiry.
Right.
What does that mean?
Basically, it wasn't that it was near expiring. It was the second jab that we want to get done before the vaccines expire. It's not that the first dose will be expiring after the first dose. The expiry of the vaccines have taken place. We're looking when a batch comes in. We're looking at the vaccines in this context. We're looking at backwards from the expiry date. We need to make sure we've covered 12 weeks at least, minimum of 10 to 12 weeks. And from there, we work ourselves out and we make sure we give ourselves time frames. Okay, if I do my vaccination 2 weeks, take about 100,000 doses, and I get 100,000 people jabbed in 2 weeks, that means I will be able to give the second jab before the vaccines expire.
Is there any reason why the Ministry of Health did not work closely with certain organizations, whether they were religious groups or they were private or public sector workplaces, to get targeted vaccinations done within a particular office or a building or any of those sorts of measures in place?
Good question. Yes, we did quite a lot in the first week. For example, with the defense forces, we did go out to them because there were a lot of targeted individuals. And then after that, in the second week, when we did the vaccination rollout of the 100,000 doses, we went out to health facilities, because that's when we opened it up to individuals, especially with the comorbid issues, with those individuals who has diabetic hypertension or cardiac issues, etc. So that's where we opened it up. And to a certain level, we also got some government organizations, some ministries, etc., to come to these sites as well, because with every vaccination team we've got a backup medical team, just as a standby, and that for us logistically needs to be in place. So that's it's pretty good support system network, a system set in place where we, for example, with the Vodafone Arena, we with 6 vaccination teams, we just had to have 1 medical team. So all our other essential services is going on. And also with all health facilities, when they were jabbing them there were doctors on standby. They were working already in those health facilities. So that's one of the reasons why we went into health facilities, because we opened up bigger, larger. So coming out of workplaces to this, and logistically it's a lot more easier going to the bigger venues rather than the smaller ones.
Well, we've come to the end of the show, but before we end, just very quickly, for someone who may think that they may have been exposed and they feel that they've gone into self-isolation, but they would have been in contact with other persons, what are the protocols? What must they do?
So if they think they were exposed, they could definitely call or definitely go into self-isolation. And apart from that, if they become symptomatic, etc., they can always turn up to the fever clinics that we've got right across the country. And the other option is always call 158, which will, if they aren't able to answer the question, they'll definitely direct those to us in the ministry for just to answer them for clarifications, etc.
Thank you very much for making time for us today. And that's all we have for you tonight. Stay COVID safe. Good evening.